Hi everyone, Dr. Emi from Pain Free and Fit. Today we're going to be going over the most effective chiropractic techniques that I've found to be helpful in low back spondylolisthesis pain. Hope you enjoy. Keep in mind the following techniques are just some of the many options with chiropractic to help patients with low back spondylolisthesis pain. Whether we're talking about mobilization, manipulation of sacroiliac or lumbar facet joints, flexion distraction to help open up the disc and the compression and extension of spondylolisthesis segments, or myofascial work to decrease trigger points, fibrosis, and tightness in various muscles that pull the body mechanically into a stressful position. The overall concept of chiropractic is to neutralize or to balance out the various forces that are improperly acting on the painful soft tissues in spondylolisthesis and provide a more normal nerve conductivity throughout the lower back area. This supports the core muscles and your rehabilitative exercises, posture, and movement changes. So let's check out some of these helpful techniques.
Flexion distraction technique, where the table is elongated, separating the involved spondylolisthetic vertebra, and flexed downwards to open the segment of the involved disc or facet joint. Sacro-occipital technique, where the pelvis is tractioned and manipulated back into a neutral alignment and torque is reduced from the meninges extending from the lower back to the head. Trigger point compression technique, also known as pneumoreceptor tonus, to reduce trigger point formation in the piriformis muscles that run from the hip to the sacrum, as well as the sacrotuberous ligament that runs from the base of the pelvis to the sacrum. Myofascial release technique of tight fibrotic nodules and trigger points in the hamstring muscles to reduce the tension or pull on the base of the pelvis. Pneumoreceptor tonus or trigger point compression technique of the latissimus muscles that run from the shoulder to the lower back. Trigger point compression technique of the quadratus lumborum muscle running from the side of the pelvis to the spine and ribs, releasing lateral or sideways tension and stress from the spine. Active release and myofascial release technique of the erector spinae muscles, which become taut and tight, increasing the lordotic stress on spondylolisthesis. Myofascial work on the hip flexor muscles, including the tensor fascia lata, as is shown in this case, the iliotibial band, as well as the rectus femoris and iliopsoas. Facet joint testing to determine which facet joint is tight and in which direction of movement is tight, and the appropriate corresponding manipulation of non-impulse recoil technique, where pressure is put in to the tight joint and then released quickly without irritating the spondylolisthesis with excessive force moving into extension. Testing and necessary treatment administered if the sacrococcygeal joint becomes hypomobile. In this case, another example of non-impulse recoil technique. Non-force manipulation of the spinous processes to open up the back of the spondylolisthetic involved segment involves a gentle pressure from the bottom of the spine towards the top during a breathing protocol engaged by the patient. This same technique can be applied in a sideways or lateral motion on the side of the sacrum to induce a lateral joint freeing manipulation of sacroiliac hypomobility or restricted motion. 5x5 mobilization of the sacroiliac joint to increase joint play motion between the sacrum and the ilium or pelvic bone.
Remember that the exact chiropractic techniques that are going to be helpful for you and your pain will vary depending on what your unique issues are. This is done through a proper diagnosis and assessment of not only your spondylolisthesis pain, but your body mechanics and how they influence the stresses causing your pain. Remember, if you're looking to hold your chiropractic treatments, the best method is to improve your spine stability, posture, and movement abnormalities that are causing these dysfunctions in your lower back. If you're looking for a great program to help self-analyze and design such a program, check out our Fast Track program for spondylolisthesis, available at painfreeandfit.com. I hope you've enjoyed this video on chiropractic techniques helpful for low back spondylolisthesis pain.